should consider if you're looking for some treatment. Okay. Then we'll also get into what a regular appointment would look like with me if you need to come in and get something looked at, and also how to book a free discovery call. So, for everybody who is here tonight, I am offering a free consult. This will just be over the phone where we can chat one-on-one, answer any questions, and go over anything that is on your mind. So we'll get to how to book that as well towards the end. Okay. All right. Good. Lots of answers in the chat. That's great. Okay. So first, a little bit about me. I did my undergrad in North Bay at Nipissing, and then I went here in Toronto to the Chiropractic College, and that is the only English-speaking chiropractic college in Canada. So just a fun fact there. There is a French-speaking one. Otherwise, you have to go to the US. And I grew up in Erin, Ontario, so fairly local, not too far from here. And in my spare time when I'm not in the clinic, I just really love the outdoors. So I do a lot of camping and fishing and boating. And there's a little photo there from a recent trip. Okay, so here is the myth or fact game. So what I want you guys to do is just quickly shoot a message in the chat whether you think the statement's a myth or a fact about chiropractors, okay? All right, so first one, once you see a chiropractor, you will generally have to keep coming in for treatments forever in order to see results. What do you guys think about that? We'll give you a couple seconds. Give me a couple answers and then we'll get going. Okay. All right, good. Yes, this is definitely a myth. Definitely something I've heard though in the last couple weeks. So let me just touch on that. People come back, but it's usually for specific reasons. So number one is they had benefit from treatment and they want something else looked at that's totally unrelated. Or the most common thing is that spinal complaints, especially neck pain, low back pain, it is very common for these to be a recurrent issue or chronic issue. So once you've had something like this in the past, it is very likely that you might have it again in the same spot or similar spot. So whether it be a couple weeks or a couple months, that could be another reason why you hear people always coming back, is because their kind of nature of their pain is a recurrent type of pain. Okay. Next, your pain is due to your bones being out of place, and our adjustments put things back where they should be. That's a good one. What do you guys think? Okay. Good. Okay. So actually, this isn't entirely true. So it might be a little bit shocking, but yeah. So the latest evidence is showing that adjustments don't necessarily work that way. For sure, your joints can get stuck, can get restricted, can be causing pain and muscle tightness in the area. That's definitely a thing. And our adjustments do function to kind of reverse that, help you move better, decrease the tension, decrease the pain. For sure, adjustments definitely do that. But to say it's because your bones are kind of way out of place and we are putting them back, it's not necessarily the case, and that's kind of what we are working with now. So definitely they do the same things for you. It's just not so much that you're way out of alignment. It's that there's just some pain and some stiffness in the area, and we're just going to help you move better. It's kind of a better way to look at it. Okay. Next, chiropractic appointments are generally 5 to 10 minutes and are mostly for adjustments. What do you think there? Seconds. Good. Yes, this is a myth. Obviously, every practitioner is a little bit different. But just as an example, my first visit, so first time seeing you, will be an hour. And then my follow-ups are about 20 to 30 minutes, depending, of course, what we're treating and what conditions we are giving. So yeah, that's just a little bit about my timing. Okay. Next, we regularly offer treatments such as taping, spinal traction therapy, soft tissue therapy, and acupuncture or dry needling in a follow-up visit. What do you guys think about that? Is that something pretty common or haven't heard much about that? So this is a fact, and yeah, so some people were saying they haven't heard much about that. So this is definitely all offered in our visits here at the clinic. I do a lot of that spinal traction. I do a lot of acupuncture and dry needling, and definitely soft tissue work. So just to kind of relax the muscles a bit. Of course, all the traditional chiropractic adjustments are done if you like as well. But these are something we also do every single day. So. Let me just go through that. Okay, and then while we're on the topic, here's just a little bit of additional certifications I have. I have my functional integrated acupuncture, so that's kind of a medical acupuncture for muscles and nerves and such. I have an international diploma in dry needling, and I also have some training in instrument assisted soft tissue. So this is what is shown on the left side there, where you use a yes, that is Graston. You are correct. So that's where we use more of a stainless steel or hard tool that's kind of angled in a certain way to strip through the tissues, which gives it a little bit different of a treatment compared to what your hands can do. So definitely do all of that as well. And then on the right there, you see some dry needling or acupuncture to the kind of upper back shoulder there. Okay. Last one, I think here, we only deal with pain relating to the spine, and we don't really have the training to deal with other areas of the body. What do you guys think? Great. Great, great. Yes, that is a myth for sure. Of course, we are like specialists in spinal health, but we do definitely have all the training for everywhere in the body. And for just a couple that come to mind, a lot of TMJ and jaw treatments I do, shoulder injuries, elbow stuff like tennis, golfer's elbow, or some stubborn tendon injuries, and of course some hip knee pain and sports injuries, all that kind of stuff. We definitely cover that every week. So, all right. So let's get started. So we're going to jump right into the causes of neck pain, and these are the causes that I see in the clinic every week, or the causes that came up in the literature I was going through the most. So at the top, we got muscle strain. Of course, muscles have a big component to pain. It's not always the joints. And then an accident or injury, so a muscle strain or sprain to the joints of the neck, or a whiplash. So something that is more of a traumatic injury to the neck can be there. These two things should be talked about more. So stress and anxiety and poor sleep. These definitely popped up in some research I was looking at for some causes of neck pain, and a lot of people tell me they carry their stress or their anxiety in their neck sometimes, and they come in when they're more stressed, they feel like their neck is more tight. So definitely those two can contribute. Disc or nerve injury in the neck. Some of you have already touched on that you have some maybe impingement or nerve issues in the neck. We see that a lot. And then the last two kind of go together, prolonged sitting or improper posture. So any kind of long hours or desk work, working from home, that can definitely give you some discomfort there. All right, so we're just going to chat a little bit about the natural course of neck pain. So let's say you have some neck pain, you woke up with it, or you tweaked it in the gym, something like that. I just want to go through a couple things. So number one, it can often resolve on its own in a matter of weeks or months. So even if you do nothing at all, it's likely that it can get better, or maybe even a little bit better completely on its own. So you don't necessarily have to worry too much about that, especially if it's quite mild. And then next is a short course of treatment can usually speed up that kind of natural history, especially if you're going towards the months and it's been a month or two and it's still there. Usually a short course of treatment can speed that up, and we'll get to the exact treatment recommendations for that. And of course, like I said before, be active in your care. Don't let it sit for too long. If you're getting towards those weeks or months, you shouldn't let it go too much past that, and you should definitely come in and have it looked at just in case. And then a recommendation here that we're going to see come up quite a few times tonight is that we want you to continue your normal activities every day the best you can, even if you're in a bit of discomfort. Um, that's okay. You're not really going to be causing more damage, and pretty much the bed rest and kind of trying to protect it too much will be kind of more harmful than good. It's showing nowadays. So stay active, keep doing your activities, and kind of try to carry on the best you can. All right, so we're going to get into the first set of treatment guidelines that were put out from this body called the Neck Pain Task Force. So they were kind of becoming a thing in 2000 to 2010 because this was coined the bone and joint decade, just because of the kind of big rise in these disorders. And what they wanted to do is create a kind of guideline for both patients and practitioners to follow, that kind of gives us recommendations for the best treatments. So this involved dozens of researchers from 9 countries all around the world, and they reviewed the best evidence to create guidelines for us. And part of this was so that they could empower people to make their own decisions about treatment, rather than, let's say, coming in and having someone tell them what they should be looking for their neck treatment. This is now public, so you guys can see what you should consider, and then what we should do to follow these guidelines when we see you in the clinic here. So we'll go through a couple messages from them first that I just liked. So number one is that neck pain is an experience. So pain on its own is an experience. It is different for everybody, but most people suffering from neck pain can carry on with their daily activities, so it doesn't interfere with their work or sleep or anything too much. But then about 1 out of 10 people will have disabling neck pain. So their lives in some way is changed, whether it be work or sleep or exercise, social life. About 10% will have that. And then this goes with what I was saying before about coming into the clinic again, is that neck pain can often be persistent or recurrent. So the biggest risk factor for getting something is if you've had it in the past. It is no different for neck pain. And then this is also a really good point that even if you're in a lot of pain, and it's kind of a new injury for you, you don't have to worry too much at first, because majority of neck pain is not caused by serious injury or disease. A lot of it is just kind of more moderate to mild stuff that we can take care of in the clinic. Sometimes we see people with really, really kind of acute new pain, and they're worried that something seriously is wrong, and that's just generally not the case. So just want to kind of help you out with that and kind of ease your mind a little bit. Okay, so here are the types of neck pain that I was talking about, kind of a new classification system for it. So we're going to get into grade 1, which is, we see a lot, this is neck pain or discomfort with no interference of your daily activities. So you can carry on as normal, but you just have some neck pain and discomfort. So we see a lot of that. And then grade 2, we also see quite a bit of this. This is probably where most people lie in here when they come in for treatment. So they have neck pain, discomfort, but it limits your daily activities in some way. So whether it be work, you can't work as good, you're not sleeping great, your exercise is a little bit kind of hindered with that. So that is grade 2. And then grade 3 neck pain is everything we just talked about, plus some nerve symptoms. So some of you may have experienced this. So this is neck pain or discomfort with some neurological symptoms such as weakness, numbness, or pain down the arm. So if someone kind of says to me that they have pain, and then they can draw a line that the pain extends down their arm and they can trace out a line, that's generally grade 3 neck pain, and we're dealing with some nerve component with that. And we also see that a lot, and it does respond to care. It's just, it's a little bit more bothersome for you. And then grade 4, there is a grade 4, but we won't touch on it too much because this is that category with the more serious injury, so fracture, infection, disease, stuff like that. Obviously, we don't treat that in the clinic. We would refer out, but just to let you guys know, there is the next grade there. Okay, so before we get to the treatments, we'll get through these kind of treatment messages that they just want to educate you guys on beforehand. So the number one thing is that there's no specific treatment that treats everybody's needs. There's obviously a range of stuff that we're going to go through that the evidence is suggesting is good, it's effective, it's safe. But obviously, everyone should be treated individually, and we will find that combination for you. So just because it worked for someone in the past does not mean that exact combination will work for your neck pain. So always kind of customizing the plan to make sure we find the ideal combination for you. And here you might think I'd be telling you something different, but short periods of care are helpful, and lengthy treatment plans are usually not correlated with greater improvement. So what that means is, let's say we see you, for a couple times a week for a few weeks, you start feeling great. There's not really a huge need to continue seeing you 2 or 3 times a week after that, and it's generally not correlated with greater improvements anyway. So that's not something that we would recommend here if you come in. And then, of course, we will always structure treatment around the patient's preferences. So what that means is that, let's say we'll go through some combinations of treatment that are good, but let's say one of them you don't like, you've had bad experience with in the past. Let's say acupuncture or dry needling, you have a needle phobia, or you've had a bad experience with needling in the past, then I'm probably not even going to put it anywhere in your treatment plan, because we both kind of want to be on the same page physically and mentally with the treatment. So if you have kind of a mental issue with a treatment, it's probably going to impact your recovery. So we're not going to put it in there. So we'll always kind of tailor our treatment plan based on what you like as well. Okay, so before we get into all the treatment recommendations for neck pain, I just want to touch on 2 terms that will pop up throughout these. So these are manipulation and mobilization. So manipulation, when you hear that, think of just adjustments. That's just the normal chiropractic adjustment when you see that word. So it's the hands-on technique where we kind of move around the joints. You may hear a popping noise. And for those of you who aren't aware, it's just a gas bubble being released from the joint when you hear that popping noise. So it's just like when you crack your knuckles, it's just a gas bubble being released from the joint when we change the pressure inside the joint. So it's nothing rubbing together, cracking, or any damage being caused. So that's all you hear with an adjustment there. And then mobilization, we'll see this a lot come up as well in the recommendations. So this is very similar to an adjustment. You guys have probably had it. It's just there is no kind of pushing of the joint. There is no popping noise. It's more of a slow, rhythmic treatment to kind of get the joint moving rather than that quick little push. So both the same, goals are the same, treatments are pretty much the same. It's just that one is very quick to be over with and there's a pop. One takes a little bit longer and there's no pop. Okay, makes sense? Any questions about that, you can just let me know in the chat, but we will get going. So this is the first set of kind of guidelines that neck pain task force has set out for us. So if you remember the grades, so grade 1 and 2 neck pain, and this is non-traumatic neck pain, so nothing from a car accident or fall or whiplash, anything like that. So what they're recommending is manipulation, mobilization. So remember, that's just adjustments, or the other type, the mobilization, and they call that manual therapy. So we're just going to combine those and call it manual therapy, okay? You should consider supervised exercise. So that's exercise where you're in the clinic or with someone that's watching you and coaching you through the exercise. You should consider a combo package of manual therapy plus exercise together. Acupuncture and analgesics, so painkillers. Obviously, I can't advise on the kind of painkiller aspect, but we'll just put it there because it is something that they are suggesting works for you, okay? So next, this is the traumatic. So now we're dealing with neck pain that is from a fall or a car accident, and you'll notice a lot of similarities. They're recommending the mobilization, so manual therapy, exercise, and again, a combo package consisting of mobilization and exercise, okay? And then this is a screenshot right out of the task force publication, and I really liked it because I just wanted to highlight a few things. So you'll see on the left, it says grade 1 and grade 2 neck pain, and then on the right, I want to highlight the first couple bullets. So it says does not require further laboratory investigation or imaging. So I've had that come up a few times in the clinic. You do not need x-rays to come in. You do not need x-rays to get your neck adjusted or treated. And obviously we do refer out for x-rays in rare cases when it's needed. I can do that, but as a routine exam, we don't do x-rays here, and you don't need them to come in and have some treatment for the most part. And another bullet I like there is that, again, reassure that serious injury is very unlikely, and that you're encouraged to stay active as possible and avoid neck immobilization. So what that means is kind of like wearing a brace or a collar around the neck because you think it's going to help. They're saying definitely avoid that and try to avoid bed rest. And just again, we're noticing stay active as much as possible, and that will be the best thing for you. So this is the second guideline I'm going to go through. This is called the Optima guidelines. So this was the Ontario Protocol for Traffic Injury Management. So similar thing as the Neck Pain Task Force. They wanted to establish a guideline, and they called these the NADs, so the Neck Associated Disorders. You see NAD. Again, it's a big multi-team of expert clinicians. So they had medicine, dentistry, physio, chiro, psychology, OT, and nursing, as well as some insurance experts. So what I like about this, again, just like the neck pain task force, is it's not just chiropractors telling you that manual therapy and other things are good. It's kind of everyone coming together and kind of giving you what their opinion is and what should be considered for neck pain. So we're going to go through what they thought, and you'll see some similarities compared to the other one. But first, of course, we want to rule out serious injury, which we will always do. Categorize the complaint into the grades that we chatted about. And then you'll see this again. Educate, reassure on benign, self-limiting course of neck pain and the importance of staying active. So that's came up so many times in all these different recommendations, and that just shows you how important it is. And then I really like this one, is that patients with any worsening physical or psychological symptoms will always be referred out. So we will always do that. We will always refer you out to someone else or your family doctor if we feel like there's something that isn't getting better and that we need another opinion. We'll always be kind of referring you out to people when it's needed. Okay, so here's the first guideline by Optima, and you'll notice same thing, grades 1 and 2 neck pain, but now they have a time frame for less than 3 months. So this is more of an acute neck pain that's more new. So what they're recommending is the education. So structured education is just what we're doing right now, is educating on neck pain, what it is and what you should do. And they are suggesting range of motion exercise, so similar. A combo package of range of motion exercise and so adjustments or mobilization, so very, very similar to the neck pain task force. A little combo package of manual therapy and exercise. And then they're also suggesting a short course of muscle relaxants. Again, I can't advise you on those, but you can always talk to your family doctor or pharmacist about that if it's something you're interested in, but it is included in here for the more new neck pain as something that works. Okay, and then here's the next recommendation for neck pain that is been around for longer than 3 months. So we're getting into that more chronic neck pain that kind of isn't going away that you thought would go away. So we'll notice some similarities here, but they've also added a couple new things. So again, structured education, range of motion and strengthening exercise. Again, a combo program of the exercise and manual therapy, so adjustments and mobilizations, yoga, clinical massage, laser therapy, and a short course of NSAIDs, so some anti-inflammatory drugs there. So the new ones here are the yoga, the massage, and the laser. So I just want to touch on the massage. So they said clinical massage. So this is not the kind of relaxation, feel good massage. This is more where it's like a deep tissue getting in there. It's a bit more uncomfortable during the session, but it is more beneficial in the long term if we're talking about neck pain. And of course, we offer that here as well. And last one here, this is the guideline put out by the American Physical Therapy Association, and they had a couple extra things to add. So they again quoted the neck pain for greater than 3 months. So you've had it for a little bit longer, and they are saying still the adjustments and mobilizations for the neck and upper back. A mixed exercise for the neck and upper back. So mixed means some strength, some endurance, and some stretching. And here they did put in some dry needling, laser, and traction. So we talked briefly about the traction therapy at the beginning about services that we regularly offer here in the clinic. So traction is just kind of a gentle decompression or stretching of the spine. We can do that with our hands, or we can do that assisted with the table. And then the laser therapy and dry needling, which is pictured again there, just proportion of the back. So for those of you that don't know, dry needling is also called like trigger point needling. So what it does is it's specifically a needling technique for those muscle knots, or people say I've got muscle knots in the tops of my shoulders. So the needling is you go right into that muscle knot, and you kind of gently manipulate the needle around to kind of diffuse that muscle, relax it, and then the needle comes right out, goes in the bin. So the treatment is very, you don't really sit for too long with the needles in. The needle kind of doesn't leave my hand, and the treatment's about 5 to 10 seconds. So very quick and very effective for the stubborn kind of muscle knots. Okay, so I will give you a quick example of what it would look like. Let's say come in for treatment. This is a real example that I'm just kind of pulling from. So this is a 32-year-old patient came in, and she had neck pain and upper back pain and stiffness, and she rated it a 5 out of 10. So moderate issues. And she also reported lots of tension in the tops of her shoulders, and it went all the way up to the base of her skull, and then some aching between her shoulder blades. And additionally, she was saying she was getting some headaches, or just kind of like tightness in and around her head about 2 to 3 times per week that seemed to get worse when her neck pain was worse. So these complaints were affecting her ability to work and her recreational activities like exercise. So if you remember from our classes, then we will grade that as a grade 2 because it's now affecting her daily activities. So diagnosis for this patient was a grade 2 neck pain. So you'll see an NAD2, which is the neck associated disorder, grade 2, and then thoracic spine, which is the mid to upper back, also some tightness in there. So those are the 2 diagnoses I went with. And these are the treatments that I did for the first couple of weeks. So the first time I saw her, we did some adjustments of the areas of the back that were tight. We did some soft tissue work to touch on that more clinical massage type of treatment, just to kind of loosen up the muscles more manually with my hands. We went all the way up to the base of her skull for those muscles. And we set that patient home with exercises to do. And we only saw her once that week. But then week 2, I suggested we see her twice. So same thing, we did adjustments, some soft tissue release, advised her to continue her exercise, her stretches, and her daily activities. And then we also added some dry needling into those muscle knots. And we saw her 3 times that week, and then 2 times that week, sorry. And then on week 3, we did the same thing. We saw her twice, and we did the same treatments we just talked about. And then by week 4, she said she had a significant reduction in her neck pain, her tightness, and also a frequent reduction in her headaches, which is really, really great. So already by week 4, we're kind of less than a month, and she was kind of discharged. We told her that she was good to go, and then to come back or call if anything came up, or if the neck pain started to come back, or things started to tighten up. So that goes back to the recommendations we chatted about at the beginning, where short period of care is likely helpful, but those long kind of drawn out treatment plans are usually not going to give any additional benefits. So that's more or less what we would do with a neck pain case like this. Okay, so just to wrap this up, neck pain is definitely very, very common. It is researched extensively, which is great. So we have a lot of tools to look at to help guys get through that kind of a painful time. And all the treatment options we chatted about today are very, very safe and effective. You probably don't need x-rays to come into the clinic. Obviously, we do kind of send out for those if needed, but you probably won't need x-rays for your neck pain, and you don't need x-rays to come in and book an appointment. And just to wrap up about staying active, even if you're in pain, it's unlikely that you're going to be causing any more damage. So just stay active the best you can, and it will be better than kind of staying in bed, and definitely avoid any neck braces. And the short course of treatment consisting of manual therapy and the exercise, which we saw through a number of different guidelines there. That's kind of the common theme. So that is something that can be helpful and that we do a lot of. Okay, so a couple questions. I'm just going to go through that I've had recently. So if you're ordering Natural Choice, the clinic here does do direct billing through insurance if that's something you want, or we can give you the invoice. It's up to you. Assessments with me are 1 hour, and they will include a short treatment at the end of each visit always. A follow-up is about 20, 30 minutes. And again, we don't offer those lengthy treatment packages. Our goal is to have you in, have you treated a little, and to get you back to your normal activities as quick as possible. But a maintenance care is also an option. So a lot of patients really like that maintenance care plan, which is, let's say you did the 3 to 4 weeks, you're feeling good. Then at the end of that, we kind of like to stretch things to a point where you're good without care, and then things will maybe tighten up again in a week, maybe a week after that. So 5 weeks to 6 weeks, you'll start having tightness again. So patients will come in at the end of that. So it's more we see you kind of as a basis rather than kind of consistently coming in when you're feeling good, if that makes sense. Okay, so for everyone who attended tonight, I'm offering a free discovery call this week. It'll be at a couple different times where we can just chat one-on-one and answer questions or concerns you may have. So there should be a button on the screen where you could book and reserve your spot this week. And we can also answer any questions you may have about setting up an assessment or coming in for more information about that. Okay? So I just want to thank everyone for coming, and I hope to see you soon.